Even where we are, you can hear the cars.
Yeah, the noise
Those are
pollution.
fumes coming into our system.
Yeah, that is not like an old person. And then you'll find there are some old people who don't have diabetes. So diabetes doesn't discriminate. If you're not taking care of yourself, you put yourself at risk of getting diabetes.
Hi guys, how are you? So welcome back to my channel. Today I have an amazing guest. She's called Charity. I will let her introduce herself and tell us why she's here.
Hi guys, thank you for having me. My name is Charity Wanyonyi. I'm a certified nutritionist in Kenya. I'm a nutrition educator in all my social media platforms, and I'm also a researcher. Yeah. I'm glad to be here.
And she's also an amazing personality, by the way. I'm so glad I've met you today. You're amazing. Charity is going to help us shed some light on some common myths about diabetes. She's very passionate about diabetes, and she's doing it as her thesis in her research. So when I tell you she understands the nitty-gritties of diabetes management, I am not lying. And you can check her out on all our social platforms. Charity Safe Haven. I'll definitely have it for you so that you can check her out. And she also creates content on YouTube, by the way. Your handle?
Charity Safe Haven. That's all I'm known in all my social media platforms.
Yeah, just check her out, give her a follow. Next time. So Charity, what exactly is diabetes?
Diabetes basically is just a group of conditions that come from someone not being able to properly control their blood sugar level. I will use sugar because I don't think people are versatile with glucose, and most of the time people ask where is the sugar coming from. The sugar comes from the food we eat. Yeah. So when your body is not able to properly control the sugar, you find that you'll have elevated blood sugars, and then after concurrent tests, like the first test, the second test, the third test, you still have elevated. That's when you're told you have diabetes. Like I had mentioned, we have three types. We have type 1. Type 1 is an autoimmune disease. Mostly occurs in young adults and children, where the body is not able to produce insulin as well. And then with type 2, onset mostly in adults and usually comes from our lifestyle choices, because along the way, because we don't properly control what we eat and our sedentary lifestyle, you find that there will be insulin resistance, and that is one of the risk factors in most of us adults contracting type 2. And then we have gestational diabetes, which usually occurs 24 to 26 weeks of pregnancy. So that's why we usually encourage mamas to go to clinic for antenatal. So all these tests can be done so that you can know if you're prone to having gestational diabetes or not. And then gestational diabetes is one of the risk factors of type 2 diabetes.
Now, in Kenya, our rates are increasing. Despite the increasing, like we have a lot of information on the social media, we have the website, there's Google, there's YouTube, there's TikTok. Why do you associate the numbers to be increasing so much in the country?
I usually say we can have the information. Someone can have the information here, but reading, comprehending it, and actually putting it to play is quite different. You find like you're telling someone, you're at risk of getting diabetes, you need to amp up the physical activity. Yes, they have listened, they know they're supposed to be physically active, but you'll find that most of them, maybe they don't have interest or they don't have time, so you'll find that they will not go and do it. So I feel like most, especially November is World Diabetes Awareness Month. The information is there, but taking it in as Kenyan people, and this is what in the healthcare, you know how difficult Kenyan people can be.
Now back to my other question. Before we get into the myths, there's a very big gap between information and actually implementing it. And this basically comes to behavior change. So how can we as professionals actually steer behavior change towards ensuring that we are promoting healthy habits? We're not just giving people information, they go and sit at home. We're giving them information. If you give them meal plans, if you tell them we want you to do physical activities, how can we actually promote uptake of that information?
I don't know if you've ever been in a situation you're actually advising a client or a patient and then they bluntly tell you, sasa daktari unaniambia nini na wewe mwenyewe, do you even exercise? So you see a client is telling you by the look of things you don't look like you exercise. So I usually tell you practice what you preach. I usually upload nutritionists who are on social media who are into a healthy lifestyle, like they practice what they preach. If they say physical activities, you see them exercising. If it's healthy eating, you see them eating healthy. Not you, a nutritionist, telling your fellow office mates, you know, you're supposed to eat nutritious food. And then when you open your lunchbox, you have like chips and fried foods, and then you expect them to take in what you're saying. So I feel like as professionals, and I applaud people, especially even medical doctors, when you see them, I encourage people to lead a holistic lifestyle. You see them also leading the holistic lifestyle. So I feel like we should pull up.
No, not even as nutritionists. I like to train my people because as healthcare workers, we have this notion that do as I say, not as I do. That needs to change.
Yeah, it
That
needs to change.
Because if I'm telling people that I want you to exercise, I want you to move, and I'm always on my bike, I'm always riding, I'm always driving everywhere, and I tell you I want you to walk, I want you to swim, and the only thing that I do over the weekends, the only thing that I can post for you is me drinking and eating my choma, that is not practical.
And then just to add to that point, I also feel like according to me what I would have loved for most nutritionists, especially in the hospital setting, where you are interacting with, let's say, people who are having diabetes, you're in a better position, first line, to interact with someone who's just been diagnosed with diabetes and you're there. I really just feel like maybe if you could create like a small community where you can do follow-up past hospital, because I feel like most of the patients, when you're told you're cancelled and you go, they usually just go and go. You never even see them again.
That's where the gaps that we have talked about having professionals. So you see, unfortunately, we cannot have a nutritionist at the clinic and at the same time she's at the community or the social work department. So we need to have nutritionists effectively distributed to all those subsectors in the hospital and even in the community, so that once that case is identified, like someone is identified as a pre-diabetic, during the CHP's round, they are not just left alone, they are actually followed up so that we see if they're actually practicing what we told them. Another thing, when you're doing that, you also need to learn the language of communication. I always say that you can be talking, you can be shouting, but no one is listening. Let's learn to understand our recipients. Let's learn to understand their pain points. What are their fears? Why are they scared? Why did they choose to come to you as a professional and not go the other way around? And if you fail to actually capture that, you have failed because they will not listen. You have to communicate.
And they will not come back.
And I also believe that as a nutritionist in the wellness space, we want to have that rapport with our clients so that, again, it's referral, it's marketing for you. So if you do the things right, good for your business. Make sure that you follow us because we're trying to create a community.
So on LinkedIn or Facebook, I feel like Facebook has a lot of people where you can get like the older generation at risk.
Now let's talk into myths. Let's start with that one that you have started. So I created a post on diabetes, macronutrient deficiencies, and link it up. I was talking about how to optimize macronutrient intake for blood sugar control and regulation. And I shared that in these platforms. Remember the time that we were doing number 1 must go? You remember? There are these groups that I was there, so I said, okay, fine. Let me just capitalize on it. Let me share my YouTube video there. I shared. And someone commented there, I will share this with my grandma or my grandpa, Joanna, was a matter diabetes. Now, the first myth is diabetes a disease for the old only?
No. Guys, diabetes is not a disease of the old. Even from the data that I've been reading and collecting, you'll find that young people, someone with that 30, like some of us, being told they have type 2 diabetes, or someone who is 21 being told they have type 1 diabetes. That is not like an old person. And then you'll find there are some old people who don't have diabetes. So diabetes doesn't discriminate. If you're not taking care of yourself, you put yourself at risk of getting diabetes. And I feel like that's where most people make the mistake. Like, mi niko mbali kushika, like I'm still young. Ati mbona niende nikimbie, mbona nikule vizuri, I'll eat what I want, I'm still young, my body is still functional. But diabetes, especially type 2, is a slow progression. So by the time you're told you have diabetes, it has already progressed.
Now, and as you said when you started, it's a group of metabolic disorders. There are so many things that can predispose you to diabetes and not age alone. There's the aspect of obesity. We are currently having a lot of teenagers having obesity. Those are also at risk of type 2 diabetes because their metabolic function is wanting. We're also having young adults, people who are just sedentary, they are just eating badly, they are drinking, the stress levels have gone high. So you don't start watching out about your health when you're 50s or when you're 60s. It starts now so that you can protect your health for when you're 50s and 60s. Now, another myth that I've had is diabetes should not eat meat.
You see, for me, when I usually counsel my clients, I usually tell protein offers a sense of satiety without necessarily leading to like the total caloric intake for the day compared to fat. You know, fat is 99 kilocalories and then carbohydrates and protein is 2. So I usually say when you're preparing your meat, I know why people vilify meat, because when we go to those nyama choma joints, the meat is you just feel like the and eat it with ugali, there's no vegetables inside. Like if it's kachumbari or managu, it's just like a small
and most people drinking, they don't eat.
Yeah, they don't eat. Yeah, they do. They just want nyama choma. So you find that protein is not bad, but what you are accompanying the protein with makes it unhealthy. Yeah, you see, the nyama has mafta, and you're still adding more mafta. You end up adding to a total over. Yeah, and then you end up gaining weight, and you're wondering, and then you start vilifying meat.
And then another thing that I've noticed with diabetes, we actually avoid meat because they don't want the degenerative effects of diabetes. So they're actually scared of the aspect that diabetes causes kidney disease. And most of them will tell you, I was told not to have meat, I've been boiling my beans and my legumes. And you get they have very good info about how to prepare the legumes. Like they soak them, they wash them well, they prepare them, and then they reduce over adding the fats and such. But again, I want to just clarify something. When it comes to protein intake, you need proteins as a diabetic patient. Because you see, irregularities in blood sugars means that you're going to have a lot of chronic inflammation. And this will lead to cell death. The cell death, if it's not optimized by adequate intake of proteins, nourishment and such, you're definitely going to experience a lot of wasting and degenerative diseases. Like you can now start experiencing all that. What we actually caution is you're not supposed to over consume. Moderation is king when it comes to management.
And then adding to that, there are 2 types of protein. I feel like most of us, we encourage diabetic patients to reduce the amount of red meat there. There's the lean meat, the white meat. Those are the chicken, the fish. Yeah, those are what we encourage you to eat in moderation. And then you limit, not exclude. Because I feel like with diabetic, the diet these days is a healthy diet, not a diabetic diet. Because when you tell them it's a diabetic diet, you're just making them not want to follow what you're telling them. Yeah, so for sure.
And then she has introduced a very interesting fact, and that was one of my myths. That diabetics have to have a diabetic meal. The menu plan. Like when someone calls you and tells you, Charity, I want you to get me a diabetic diet. What comes into your mind?
For me, I usually ask them, who told you there's a diabetic? Yeah, that thing was scrapped off long time ago. These days we encourage healthy eating.
Holistic eating.
Yeah. You invest in nutrient-dense food, whole foods, lean proteins, and a lot of vegetables. With fruits, consult your dietitian so that they can tell you which fruits are because of the glycemic index and load of the said food. If you don't know, because I feel like we have Googlers. I usually call them Googlers. They Google and then they come and tell us, there's a diabetic diet, this is the diabetic. They tell you, like, they show you, like, this is what they have.
And I feel like, you know, if you have your blood sugars controlled, assuming now you're not in a clinical setup, because if you are clinically ill, let's say you're admitted in the wards, there will be a lot of restrictions to stabilize your blood sugars. So if you're not clinically ill, you're managing your sugars well at home, you can actually plan your meals holistically, and you can still have your fruits. Like, I don't like limiting, because again, diabetics have a lot of issues when it comes to their digestive issues. So you want to limit things that are going to alter their enzymatic or their acid production as much as you can, to ensure that things are at balance. So for diabetics, if you are at home and you're managing your sugars, your control well, you don't need to worry so much about excluding things. Just make sure that you lean towards intake of whole foods, and again, portions and timings matter a lot, because I feel like you cannot tell someone to fast and they're taking their insulin in the morning, or they're taking their metformin in the morning. If they do that and they've not eaten anything, they'll go hypo, and they
one might collapse on you, and you're wondering what's the problem. So someone did not eat before they took their medication, which is very sad. Diabetic management education is very, very good. Like when someone is told you have diabetes, people at the clinic are supposed to thoroughly counsel, thoroughly educate and impact the intervention on, and do thorough. I feel like follow-up is a bit of a gray area when it comes to management. Especially
in Kenya. In Kenya, there's a lot of gaps when it comes to follow-up, because we don't have enough professionals. And we're hoping the ministry will actually
they'll do something about it.
It's really, really bad, because we cannot have data saying that, we are having a looming crisis of NCDs, and we are doing nothing when it comes to prevention and matters nutrition. Anyway, that's good. So no diabetic diet, holistic living is the solution. Now, on obesity, you know, I met someone not so long ago, and she was like, we're talking about diabetes. So she's a mother of 3, she's overweight, she's obese. And then so I was telling her the risk, and then she was like, so kona bahati huwezi pata diabetes, because she assumed now that I'm not obese, I will not get diabetes. Does diabetes affect obese people?
Obesity is a risk factor.
A serious one.
It puts you at risk, like frontline risk of you getting diabetes. Like when your body starts resisting the insulin being produced, it means the glucose is not being taken up by the cell, and then you find that you have a lot of free sugars in your blood that will lead to elevated blood sugars. Right? So obesity puts you at risk. That's why when you're obese, there's thorough intervention put in place in terms of weight loss, what you're eating, and just being physically active to help reduce. I don't know, I feel like people don't understand this factor.
You know, again, that comes to the aspect of education. Like I had a client, she was in Saudi, so she called me, she was like, go see my mom. When we were having the conversation, she even sent me a voice note like, mama yangu ni mkonda, sijaelewa kwa nini amepatikana na kistaru. So the mom is lean, is very slender, and she was diagnosed with type 2 diabetes. So the other factors, there's the toxin exposure, there's the age aspect, there's again the dietary practices, there's the metabolic factors, and the comorbids, like you can be having high blood pressure. As I said in other videos, you can check them out. Blood pressure is already a comorbid, or is a risk factor. If you have blood pressure, you're already at a risk of developing type 2 diabetes because of irregularities in your metabolic function.
So let me just summarize it. When it comes to risk factors, there are modifiable risk factors and there are non-modifiable risk. Non-modifiable risk factors is what she has said. We have the age, ethnicity, your family history. If you have someone who has diabetes, you have to take care of yourself because it puts you at risk of getting diabetes. And then we have the modifiable risk factors like obesity, sedentary lifestyle, diet. Those are things you can change as a person. Stress, your mental health, your gut health. Those are things you can work and change. You can modify them to reduce the risk. But the non-modifiable ones you can change. Your age you can change. Your family history you can change by your family.
You cannot change your DNA. Sometimes we want to, but we cannot.
Yeah, you can.
So Charity, kindly, this one is a serious one. Carbohydrates at the end.
This is very common. Even when I was collecting my data for my master's, I got a lot of tuliambiwa diabetes mbaya, tusikule carbohydrates mbaya. Carbohydrates are the first food groups to be broken down. And then there are different types and different kinds of carbohydrates. We have the simple sugars, we have the complex, those are the fibers, and then we have the resistant, the starch, right? So you have to know which one you're supposed to. Of course, if you eat simple sugar, like you're diabetic and then you go and take soda, you know those non-sugar, like low sugar. I always say this because they like to.
Let me just, you see diabetes will tell you, I have to drink soda, I have to drink, it's commonly passion, the passion one, or the grey one is Stony
and Coca-Cola for no sugar.
For instant sugar. No, they'll tell you, oh, my blood sugars are low, I have to drink that. There are alternatives. You don't have to do that. You don't have. There's something like what I'm having right here. Where is my pineapple?
She bought
something like this. You can have
this still has sugar. Like you can see the water.
You can even drink the juice.
Yeah, the juice is still sugar.
If you're going high
from the fruit. And they're usually told to have like a sweet somewhere to just and make sure you don't let yourself get to that point where your sugar is. So if you consume like the simple sugar, like that soda, of course it's going to spike, but it's going to be easily absorbed in your blood. But if you take the fruit, let's not look at the water, let's take the fruit. It's still intact. So if you eat it, your body is going to slowly break it down, so your sugar will not. I like telling them their sugar spikes and crashes. So even if you as a normal person you take soda, you're going to have a sugar spike and then crash, and then you'll find you're sleeping after eating a lot of carbohydrates, right? So you have to know which kind of carbohydrates you're eating, and most of your certified licensed nutritionist and licensed dietitian, they will guide you on what kind of carbohydrates. We don't encourage elimination. If your sugars, but there's some people with their sugars are just 30, like they are constantly 30, we'll work with your doctor to know what's best to do in order to reduce the sugar. But if your sugars are near normal, you'll work with your nutritionist and dietitian to tell you which type or which kind of carbohydrates to eat.
Even I feel like even with the sugars that are actually all over, like constantly high, the timed testing, after consumption of meal, as a dietitian you can actually observe if you can spend like 24 hours with a client, or even 10, 12 hours, because 24 hours might not be practical. You actually see what they are eating, and then you will be able to gauge where their sugar spikes are coming from. And sometimes it's okay to regulate the intake of carbohydrates if your sugars are too much. But again, you also need to understand that carbohydrates are not the only thing that are going to translate or to actually spike your blood sugars. Eventually, protein does the same. So moderation of all the macros is important. Okay, the fats don't do that. Fats are the only ones that don't do that. But the rest of the nutrients will do that. So moderation is key.
Very important. And carbohydrates are not bad.
They're not bad.
I don't know. I just know which type to eat.
And as you said, you also need to understand the spikes.
And the spikes and the crash.
And as a diabetic, you want to avoid such as much as you can, because apart from the fact that they're going to affect your energy flow, they're going to affect your moods, they're going to give you fatigue, you're going to have all these insomnia problems.
Have a hard time, because I've interacted with diabetic patients who are telling me, like you want to do something but you don't have the energy to, because your sugars are low or they're just high when you wake up. So you have to sit.
And then those dips will actually affect your intake. So you'll end up having crazy cravings, and this will definitely affect your nutrition in the long run. So you need to avoid that. So another myth that I've heard is that fat is the enemy when it comes to blood sugar control. Let's talk about fats. I will have a dedicated video on that, because fats are not.
For me, according to my experience and what I'm doing currently, for me, I'll go by what I said with the carbohydrates. Know which type of fats you are eating, guys. Know which type of fats you're eating. You have the healthy fats and the unhealthy fats. The saturated and the trans fats. The trans fats are such like Prestige and Blue Band. I'm sorry to out you guys.
No, it's true. It's true.
This liquid oils, and then they solidify. You're like, you're supposed to be liquid. Why are you solid? There's some companies, guys. You're like, why are you solidifying? You're supposed to be liquid, you know.
And then
it
things
will
like
save
nuts.
you.
Nuts are so healthy.
Those are the healthy, the polyunsaturated.
Of course, if you overconsume avocado like some of us, you gain weight. But it's not the worst
still
thing.
fat at the
It's
end
not the
of
worst
the
thing.
day.
Because now someone told me that I'm actually maturing into womanhood. I overeat avocados, but don't do that.
I
Don't do
also
that
love
if you're
avocado, so
diabetic.
I'm quite for you also love avocado. Yeah.
Don't be like me, be different.
Yeah,
Don't be like us. Because you see, us, we are going to eat like that one avocado, one that you're thinking it's big, but again, we are moving all over, so you need constant flow of energy.
Yeah.
So it's very,
And
very
also,
necessary.
Lillian, there's something I think we can banter on is fats and its relation to especially us women. We need fats.
We need
Hormones and also generally for the fat soluble vitamins.
And also for giving birth. You know, you need to have your wounds a bit cushioned.
Yeah. So with
need to
diabetic
store-
patients, know which type of fats you're consuming. Yeah, I know there's some people who are told to totally eliminate fat, so you find that most of them, they don't eat fat at all. But just look at the type of fats you're eating and the quantity they are not.
This data that is actually inclining that women are currently developing type 2 diabetes more than men.
Yeah, even in my research, I found out there were more women with diabetes than men.
Yeah, so as women, we are I don't want to call ourselves cooks, but we are the ones who prepare family meals, so we need to improve.
Yeah, we need to improve.
And you see, diabetes compromises fertility, it affects it negatively, hormone life, such and such. So as women, we need to improve when it comes to our meal selections, our meal preparations, and even serving sizes and such to promote our holistic welfare as a family, so that we reduce that.
And then to just add on that, I find that actually women who have gestational diabetes, you'll find that you're also putting your baby at risk, because you'll be at risk of getting a big baby. Yeah, then that big baby will be big, because I've ever dealt with a client who was like 5 years and 65 kgs. Like you said, it puts you at risk of developing type 2 as a young
child.
So it's
Which
very,
is quite unfortunate. We need to improve.
Yeah.
So the ball is in our court, the female gender.
Yeah.
We need
Because
to
we cook and eat in the kitchen.
So as we cook and taste, we remember that we're going to be
Yeah, so this basically what we were saying was women, we need to do better as people who are into meal prep.
Yeah, we need to improve. And also when you're going to the market, select healthier foods. Because you're also doing it for yourself and our future generations.
Yeah.
We need to have strong people. Now, I saw, anyway, we'll talk about that later. Now, another myth that I've come to, that is very common, is that you can reverse diabetes. Shed some light on that. How can
Actually, there were recent studies and actual data, like I've seen someone being in remission.
Remission
but
is
you know you can be in remission.
Remission is very
But for me,
possible.
from all the studies I've done, reversal is very, it's not common. Because diabetes is a lifestyle disease, it's long-term management. So reversal.
And also, I believe, from what I have gathered about diabetes, and I believe it's a lot, you can reverse comfortably pre-diabetes.
Yeah.
You can reverse insulin sensitivity or its resistance, and you can also reverse any other blood sugar irregularity like hormonal imbalances and such. But once you're termed diabetes, what is diabetes? Diabetes is either type 1 is basically your body is not able to produce
insulin at all.
Now in type 2, your pancreas is not able to produce beta cells that are active or sensitive to that insulin that your body is producing. So type 2 is basically insulin resistance that has outgrown the resistance phase. Now it has become, now your body is no longer identifies with it. So the cells are kind of dead. So unless you do a transplant of the pancreas, you will not come across like conclusive studies that have actually shown that this person, beta cells are now able to control their blood sugars even when they can go back to their normal life. You see, I'm living, let's say I'm not diabetic, and God forbid you become diabetic. Our lifestyle choices will be different because my body is able to self-regulate through homeostasis. It can be able to eliminate the sugars without actually having me affected negatively. But you who has remitted or who has had your diabetes remitted, you have to make sure that you are constant, not in a stressful way. You just make sure that you're living comfortable life years, you're living holistic life years, but you need to always be on the lookout on what you're doing. That is remission, caution. So you can achieve remission 100%.
But reversal
But reversal, there's no conclusive data. We are waiting on that. If it comes out, we are
We'll
definitely
tell
going
you
to
more.
pick
But
up.
remission I've had.
Remission
I've
is
had
very
a lot of
common.
people like they're taken off medication and they manage just
Diet
lifestyle.
and lifestyle,
Diet.
yeah. It's very possible to get off medication and manage your blood sugar with diet, but you have to be very disciplined.
Yeah,
Unfortunately, most of us are not disciplined because we want to exercise today, tomorrow we
we are
stop.
not.
Or you can find like those people who achieve remission, they're either in a controlled environment, like they're being watched, so they feel like they have to deliver, but once they go home, are they going to continue the same style? No, most of them don't. That is where the problems come in. But if you can actually comfortably adjust to the behavior changes that you actually advocate for, you can comfortably remit or actually achieve remission of diabetes. Yeah.
Remission is achievable,
Very
but
possible.
reversal,
But discipline is key. You have
commitment,
to
discipline. You have really to be disciplined. Because I remember when I was doing my internship, there was a patient X who was told they have diabetes. I remember they told us, I'm going to beat it.
Yeah.
I'm going to beat it. I'm not going to take medication. I'm going to do it. 1 month later, the person came up. Sugars are bad. Because the person wasn't taking in like what the person was told. No management. He just wanted to assume he does not have diabetes.
Yeah. And then again, let's remember that diabetes is not a death sentence. People live with it. I know someone who was diagnosed with diabetes in 1996. They're still okay. They've had their babies. They're comfortable, and they're still okay as it is right now. Of course, they're taking medication. They've reduced significantly, but you see, the lifestyle that person was living that then has actually changed a lot. So there are things like natural remedies, like these herbs, like fruits, green therapy. These are trees. You can't see them. But anyway, there are those therapies that can actually help you in management. But again, caution is needed when you start in. Understand what you're taking. Of course, there's the aspect of dietary adjustments, and you can live a comfortable life. You don't have to get panicked, because people panic a lot when they're diagnosed with blood sugars. And people live comfortably with blood sugars. If you learn the art of management, which is not so hard, I don't believe it is hard.
It's not
so hard.
As long as you have a dedicated team with you to work with you, and if you feel overwhelmed, sometimes you can reach out to mental health specialists to just work with you, because the journey sometimes
can be overwhelming.
It can be overwhelming.
And then again, understanding people around you, like your family members, they need to also understand that they don't have to like kind of stigmatize you, like, oh, you're not going to have that because you're diabetes. You know, sometimes holistic living. I usually tell someone, if you want to live healthy and have comfortable life, you eat what a pregnant or what a diabetic patient is supposed to eat. You just you'll be very healthy, because they're supposed to optimize their diet, limit toxins, limit stress, limit alcohol, limit smoking, bad fats, bad sugars, because you want to have the best outcome for your baby if you're pregnant. And if you're diabetic, you want to make sure that you're controlling your blood sugar,
so that you don't experience those short-term complications that come with uncontrolled sugars.
So that you can comfortably live with diabetes for long. So we have we have I think generations, we have talked about this, diabetes we have talked about this, normal life. Now can we talk about diabetes specific products? Like the imagine I'm forgetting the biscuits, what are they called? Treptine.
Those supplements for diabetic.
Does a diabetic patient have to really rely on them?
Not really, but there are some cases, especially for some, there's some people who have fluctuating weight. But they have seen someone who is just being diagnosed with diabetes, and 2 months in, we are controlling the sugars and everything, but
the weight is going down.
So supplementation, supervised supplementation.
That is necessary.
It's necessary. For me, for my patients, I used to get them from teams. He used to supply me with those specialized feeds, especially because sometimes you'll find in a ward you have a patient who is bedridden, losing weight, and they're diabetic. So what would you do? You have to supplement what they're not eating.
And then, as she has said, uncontrolled weight loss is another complication of diabetes. So if you actually find yourself, previously you tried to lose weight and nothing was happening, then you give up. And then now you're living your best life, and then all of a sudden you start losing weight, and then you start getting excited. Please go get your sugars checked. That is very dangerous. That happens a lot, and it can be quite difficult to manage. You have your blood sugars high. That's where the dietitians have a very difficult time, because you have your blood sugars have skyrocketed, and your weight is going down. So we want to manage your weight. We want you to gain weight. We cannot tell you to have high energy, high protein kind of meals, and we still want you to control your blood sugars.
That's why the supplements. If you noticed when I create content, I don't fully display supplements.
No, you can't.
Because there are some cases, genuinely they need supplements. And misuse of supplements is why I draw the line. I'm like, no, don't misuse supplements, guys. But if you're diabetic, you're losing weight, and your sugars are just, you want to eat, and when you eat, your sugar spikes, and you're losing weight, and you can do the supplements control, supplement supervision with a registered dietitian who works alongside the doctor to know, like, okay, this is what we are doing. Because diabetic management, you have a team.
And then you see sometimes the good thing with those therapeutic foods is they're pre-digested. So you will not undergo through the whole process of blood sugar spiking and such. But again, there are people who abuse those supplements. I have met them. Someone tells me, you need to supply me with diabetic. But you're okay, your sugar is good, your weight is good, what's wrong? No, I don't want to be. But anyway, people have stigma.
Do you think it's the placebo effect? Like someone thinks like
it's the placebo effect.
Like this is superfood, it's going to help cure me. At the back of their mind, sometimes they usually they nurture this hope, like, I'll beat this will be over. Like, this is just
but
something.
They can't. The only thing that you cannot beat is death. The rest you can beat.
So you find them holding on to supplements for they think like superfood, like you say nutraceuticals. So you find them misusing. For me, when you misuse or you overdo, I draw the line. I'm like, you know what?
So there's a lot of enlightening and a lot of information that needs to be done surrounding nutrition supplements and diabetes. And maybe we should do a webinar.
Yeah, we should.
We should
do a webinar.
You guys, make sure that you stick around. We'll give you details.
We do a webinar on just creating awareness around the common things people should know. Like a layman, someone should know about diabetes. Because we talk if you've noticed, I've tried to simplify. Because when you talk too technical,
people don't listen.
Like you're talking to your family and you're telling them, and they're like, unasema nini sasa? Like we need to understand like
the basics.
And I feel like that's where those people
are beating us. Because we want to come with jargon. We want to be seen that we know. As we don't know. We are willing to
so you find that these people, they come and take over because they explain, they break them down, people understand, and then they take their truth. Because I've seen someone on TikTok saying, we don't take fruits.
People are being misled, my friend. People are being told to eat avocado, eggs, and sweet potatoes
and eggs.
What else? They're only eating like 4. That diversity score is 0. Eggs. I saw eggs, avocado, cabbage, and sweet potatoes. And meat. Those are the only things that some people are being told to eat. Please don't be like those people. You see, for a keto diet, keto is very beneficial. I will not dispute the benefits of keto even when it comes to controlling blood sugars. But again, the long-term success of keto, you need to include dietary diversity for you to be able to sustain it for long. You can't be on fiber supplements forever.
No.
You can't be on like multivitamins forever. And we have fruits, we have food that you can get the vitamins from, the B vitamins from. So to avoid all this complicating of your life, it's okay to do keto every once in a while to shake up the body and tell the body to detox things.
Please relax, and then you slowly incorporate yourself back to healthy eating. And I feel like this is where we people go wrong. Like you come off these fat diets and then you gain the weight back, and then you just want to
jump.
We have a lot of work to do as nutritionists and dietitians. We really have a lot of work to do.
And I think we should come up with a weight management program whereby we are talking about the basics. So in that webinar that we'll be doing, you guys will have to support us. It will be charged.
You should support. We need to make money to and also like create content for you guys to.
So that you keep on it.
We should.
We should do a webinar. That one we should be done. I'm serious.
We should. I'll push you. She knows me. I'll push her.
Anyway, I had those 8 minutes. Was it 8 or 9 about diabetes?
We talked a lot until like I feel like we talked like 20, but we've debunked most of the common.
So let me know in the comment section which myth resonates with you and which myth you think that we have not debunked. In fact, we have made it more complicated. let's continue the conversation there. Make sure that you follow us on all socials. Charity.
The Charity Safe Haven on all platforms.
For me, it's Mumina Wellness in most of my platforms. In the other ones, just search Lilian Mumina. I want to maintain my personality and my business. I beg.
True.
So thank you so much. Thank you so much for watching. Make sure that you subscribe. Please give this video a like and share with a diabetic person or someone that you know who has a diabetes, or share with anyone, because we are all at risk of developing type 2 diabetes, provided we are alive and moving in the current world where there's a lot of toxin exposures. Even where we are, you can hear the cars.
The noise
those are fumes coming into our system. So thank you for watching. Till next time, bye.
Thank you, Lilian.
That was so much.